Do you want to understand more about rapid mood swings, or do you know someone who deals with this inconstancy and know how much it gets in the way of everyday life? What happens is, some people look great, smiling, happy, and, sometime later, they are very angry or even sad and crying. But what's up, doctor? Do these changes indicate that someone is bipolar? How do you find out? Is there a treatment? Really, many questions arise, but stay in this video and I'll tell you about these issues. So let's unravel the bipolarity. The term bipolar has become quite common in popular parlance, as it is used to describe someone who changes mood suddenly, in a matter of hours or even minutes. Usually these people are seen as unstable and even difficult to deal with and live with, causing damage to the social environment in which they live, for them and for others. However, this term is used wrongly by most people. The correct definition of bipolar disorder is present in the Diagnostic and Statistical Manual of Mental Disorders, also known as DSM-5, used for diagnosing various psychiatric illnesses. He characterizes bipolar affective disorder not by sudden mood swings over minutes or hours, but over weeks or months. In addition, it is necessary to emphasize the fact that it is not about changes in emotions per se, such as from sad or angry to happy or anxious, but, in fact, about the individual's general mood. For example, the way a person sees life, pessimistic or optimistic, unwilling to do anything, or with so much energy that they can't sleep. Those more intense and general contrasts. These changes take time to occur, and it's not just about what emotion the person is externalizing. Daniel, can you describe the behavior of a person with bipolar affective disorder? In summary, bipolar affective disorder can present two mood states, depression and mania, or hypomania, a milder form of mania, let's say. During the depression phase, the individual performs few activities, is unmotivated, sad, without prospects, and unwilling to do everyday activities, even those that used to give pleasure. Mania, on the other hand, is a phase characterized by high self-esteem, euphoria, joy, few hours of sleep per night, and the feeling that the individual is capable of accomplishing anything, that he is invincible, and all of this without feeling tired. Often, during this phase, individuals may experience excessive spending, buying more than they can afford and going into debt, in addition to having exaggerated sexual behaviors that are incompatible with their usual personality. If you witness these moments in someone's life, or even experience these symptoms, it is essential to seek specialized care with a psychiatrist, as bipolar disorder significantly affects the quality of life not only of those affected, but also of people around. As there is no test capable of diagnosing the disorder, it is performed after some consultations with an experienced doctor in the area, who identifies all possible characteristics related to this disorder, in addition to excluding other causes that may be giving the same symptoms. Now, doctor, what about the treatment? Is there a cure? There are hardly any cures for psychiatric disorders, but with proper follow-up and drug treatment, there is a way to control and stabilize the condition. But Daniel, when I have these mood swings that usually happen on the same day, and sometimes, even though I'm fine, I get really sad or really angry. What is it? Isn't it bipolar disorder? Well, you probably don't have bipolar affective disorder. But only the individualized assessment will confirm that. But in this educational video, I can tell you what usually happens. In most cases, it's physical and mental overload, accumulated work stress, bad eating habits, sedentary lifestyle, and several other causes. They can culminate in mood swings and result in damage to social relationships. But this does not mean having bipolar disorder per se. It is important to maintain attention and care in relation to lifestyle habits, with the practice of physical exercises regularly, at least 7 hours of sleep a night, and a healthy diet. All of this will help to avoid the accumulation of stress and explosions in mood. But if you are doing all this, have good eating habits, practice physical exercises, and do not use licit or illicit substances, and even so you feel that mood swings are frequent and impair your quality of life, what could be happening is also a cyclothymic disorder, or cyclothymia, in which depression and mania are much milder and last much shorter, sometimes even going unnoticed by many people. In the case of this disorder, unlike bipolar disorder, mood swings can occur suddenly, and the main difference between them is that cyclothymic disorder presents itself in a much lighter way. To actually receive the diagnosis, these symptoms must be occurring for more than half of the days during a minimum period of 2 years. That is, in a period of 2 years, it is necessary that in more than half of that time you have noticed changes significant in your mood. Cyclothymic disorder is mainly treated with psychotherapy sessions so that the patient learns to deal with his mood swings in a way that does not affect his social relationships and his work, and, in the most severe cases or those that do not respond, only with psychotherapy, the use of mood-stabilizing medications may be indicated by a specialist doctor to help control these symptoms. Did you understand? If you have any questions about the topic, leave a comment here and I'll answer in text or record another video about your question, okay? Subscribe to the channel right now, just click the red button, leave your like and send this video to someone you think will benefit from the information shared. Maybe someone close to you who suffers from these mood swings. It may be the first step for her to seek professional help and be happier. Now a special invitation for you. Consider clicking on the button Become a Member. This way you will sponsor the existence of this channel and you will also receive exclusive content for sponsors. Click Become a Member right now and see the details. Here, Daniel Coriolano, big hug and we'll see you in the next one. Thanks.